Hi folks, Dr. Scott Niblo, Norfolk Chiropractic Center. Today's topic is, what is the C word? Now, my least favorite word in the office, as people know, is I need to be cracked, or I'm here because I think my back needs to be, just feels like it needs to be popped or cracked. So, what is that sound and what are we really trying to do, treatment-wise? So what we're trying to do is restore some type of joint function to an area that doesn't move well. A loss of function is really what we're treating. In an area that is lost function, looks like I lost range of motion, and you may have a symptom with it, but in order to treat that, you are trying to what's called cavitate, that's the appropriate C word, cavitate the joint. So cavitation, if I have a vertebra and another vertebra and a disc in between, if I tilt one vertebra or separate them, I create cavitation in the joint. So a joint, vertebra, disc in between, joint complex. When the joint is cavitated, you hear an audible release. Audible release is the cracking sound that you hear, but really it's carbon dioxide being released from that joint capsule. And when carbon dioxide is released, pressure is released, and in result, you should return function to the joint. So the immediate thing that people notice if they are, adjusted appropriately is an immediate return in function, joint function. Hey, my range of motion is immediately better. Now, that joint capsule may swell again later because this may be an acute situation and they feel like they need to be treated again. But the idea is to restore the joint so that it returns to its normal function and the person doesn't need to be treated forever or anymore. But that, the end game again is return function, regain strength, and then the person doesn't feel like they need any C word anymore because there's no more pressure on their spine.